Diabetic retinopathy, stages and treatment. Diabetic retinopathy is a serious sight-threatening complication of diabetes. It interferes with the body's ability to use and store sugar. If not treated, it could cause blurry vision and blindness. It tends to progress in stages, and with every stage, the vision worsens. Welcome to the channel Health Empire. Today, we've put together stages and treatment of diabetic retinopathy. Stay tuned. Don't forget to like and subscribe to our channel to see more educational and informative content. What is retinopathy? Diabetic retinopathy is a diabetic condition that can result from high blood sugar levels. Consuming excessive amounts of sugar on a regular basis can damage blood vessels throughout the body, including the retina. Our eye retina can detect light and send signals to the brain through the optic nerve. Sugar blocks the retina blood vessels, which leads to bleeding. Our eyes then grow new blood vessels, which can cause more bleeding. This process is called proliferative diabetic retinopathy. Stage 1. Mild non-proliferative retinopathy. Mild non-proliferative retinopathy is called background retinopathy. It is the earliest stage of diabetic eye disease. This means that there are protuberances in the tiny blood vessels in your retina. These protuberances or swells are called microaneurysms. They may cause the vessels to bleed small amounts of blood into your retinas. The changes typically do not produce symptoms and cannot be seen by the naked eye. As the disease progresses, hard exudates abnormalities in the growth of blood vessels in the retina, and bleeding from the veins that feed the retina may occur. Keeping your blood sugar, blood pressure, and cholesterol levels under control can help you get rid of this disease. If the doctor diagnoses you with this condition in both eyes, you have a 25% chance of progressing to the third stage in the next 3 years. While it isn't a threatening condition, it can still trigger macular edema, which can cause rapid vision loss at any stage of the non-proliferative disease. The vascular changes can lead to retinal ischemia and trigger progression to sight-threatening proliferative disease. Stage 2. Moderate non-proliferative retinopathy. Moderate non-proliferative retinopathy is the second and slightly more severe stage of diabetic retinopathy. As the disease progresses, blood vessels that provide important nourishment to the retina may swell and lose their ability to transport blood, which leads to a decrease in the supply of nutrients and oxygen to certain areas of the retina. In this stage, the appearance of the retina may change as a result of these symptoms. But these changes would only be visible to your eye doctor during a comprehensive eye exam. Untreated moderate non-proliferative retinopathy may lead to diabetic macular edema, or swelling in the macular region of the retina, which can cause serious vision loss. Stage 3. Severe non-proliferative retinopathy. In this stage, the blood supply to the retina is disrupted, leading to more damage in the blood vessels. Your blood vessels then become even more blocked, which means less blood goes to the retinas and scar tissue forms. The lack of blood then triggers a signal to your retinas to create new blood vessels. In severe non-proliferative retinopathy, sometimes blood vessels block completely, which is called macular ischemia. The patient describes the condition as dark spots, floaters, or blurry vision. This is one of the most dangerous stages, and there are higher chances that you will lose your vision. Early treatment can stop vision loss, but losing little or more vision in this stage is unlikely to improve. Stage 4. Proliferative diabetic retinopathy. Proliferative diabetic retinopathy is the stage where the vessels get thick and weak. New blood vessels grow in your retina and into the gel-like fluid that fills your eyes. This growth is called neovascularization. In this stage, vessels often bleed, which causes scar tissue or clouding vision. As soon as the scar tissues get thinner, it pulls the retina away from the black of your eye, which is called retinal detachment. It can lead to permanent loss of both straight ahead and side vision. The circulation problems deprive the retina of oxygen. Other complications include the impartiality of the retina due to scar tissue formation and the development of glaucoma. Glaucoma is an eye disease in which there is progressive damage to the optic nerve. This greatly raises eye pressure, which damages the optic nerve. Treatment of diabetic retinopathy. The longer the diabetic retinopathy goes untreated, there are higher risks of permanent vision loss. The best way to protect your vision from diabetic retinopathy is to keep your diabetes under control. Your doctor will likely watch your condition until you're close to the latest stage. When that happens, there are several treatments you can try. In the first 2 stages of mild to moderate, you may not need immediate treatment, but your eye doctor will probably want to monitor your condition closely with regular eye exams. Your doctor may give you a shot in the fluid of your eyes to keep abnormal blood vessels from growing. Laser surgery is suggested to avoid loss of vision or an implant of steroid drugs directly into your eye. A diagnosis of severe NPDR or PDR needs immediate surgery. Routine examinations are required in all 4 stages to monitor your condition. Effective blood sugar control can usually slow the progression of early stages. Vascular endothelial growth factor. A medication called vascular endothelial growth factor, VEGF, inhibitors can help in improving the vision and stop the growth of new blood vessels. Some people may no longer need injections after the first shot, but for some, they will need to continue with the medication to improve their vision. Photocoagulation. Photocoagulation is also called focal laser surgery. It helps to stop or reduce the leaking of blood or fluid into the eye by burning and sealing the damaged blood vessels. This procedure may not restore your vision, but it will prevent your condition from worsening. Vitrectomy. Vitrectomy is a surgery that involves making a tiny incision in the eye to remove blood from the vitreous fluid, as well as any scar tissue that may cause retinal detachment. Panretinal photocoagulation. Panretinal photocoagulation surgery uses lasers to burn the damaged blood vessels so that they shrink. During the procedure, the areas of the retina away from the macula are treated with scattered laser burns. The burns cause the abnormal new blood vessels to shrink and scar. This procedure is extremely critical, as you may experience loss of peripheral vision or night vision after the procedure. So, what are your thoughts on today's video? Let us know in the comments below. Also, make sure to leave us a like, share this video with your friends, and also subscribe to our channel for more videos just like this one. We hope you enjoyed it, and we'll see you next time.